and relax down there. That's the pelvic floor muscle. So all these muscles work together. They contract together, they relax together. We can't isolate them. So it's a huge myth that everyone thinks, oh, well, I had a baby, it's okay. I pee myself sometimes and I cough and when I sneeze or when I jump on a trampoline, which is false. That means there's something wrong with your pelvic floor. Just because you pushed a baby out of it doesn't mean that it should leak. So, okay, yeah, as you hit menopause and we get into our 80s, and I see women in their 80s that do well with pelvic floor therapy. So it's a false statement that you had a baby and you pee yourself. It's also a myth that you should just do Kegels, Kegels, Kegels to prevent having leakage. Kegels are not necessarily the beyond all be all because you can have pelvic pain, which means these muscles are too tight. So I'm treating 2 women right now that had a C-section. So they think, oh, my vagina's fine because I didn't push a baby out of it. False. These muscles, what they do is they hold on to bladder, uterus, and colon. So your uterus is what holds the baby and expands, and what holds everything up are these muscles. So for 9 months, these muscles are trying to support these growing organs. And then when you don't have that vaginal delivery and they cut these muscles here, these muscles can still be overworked and too tight. So I actually discharged her. She had twins and she went to have intercourse after her 6 weeks visiting her GYN and couldn't do it because she had so much pain. So her GYN sent her to me and she was like, I just don't understand. I had a C-section. Why are these muscles affected? And it's why they're supporting your uterus and bladder through your 9 months. So I treat a lot of women that, if they had any kind of trauma during birth, it's normal to have a first, second degree tear which means that you tear vaginally into these muscles. And when they say you have a tear, you're tearing muscle. I've seen women that have 4th degree tears where they tear all the way from vagina to rectum. So I'm not trying to scare you, but I'm letting you know that can happen. So what do? They can sew you up, and then you have scarring. So the scar can prevent those muscles from being able to contract and relax like they should. Same thing with a C-section. They cut those muscles. They cut these muscles, or you tear them. So how does it recover? When you come to physical therapy, we work on the scar tissue and then re-educating the muscle. Just imagine if you, had knee surgery and they cut your knee, the first thing we would do is work on the scar tissue. And again, it makes me sad in our healthcare system that the whole trunk, whenever there's any kind of scarring to your abdomen or pelvic floor or anywhere on your stomach, it's just missed that, oh, you have you had your gallbladder taken out, no big deal. But sometimes people have adhesions. And when you have adhesions, those muscles can't work like they should. Am I talking really fast? I'm a loud, fast Italian talker, so let me know.
They're used to it.
Okay, good. Yeah, I know. You're a talker as well.
Hands.
So, lesson learned too. After you have your baby, at 6 weeks, you go to your doctor and they say, okay, you're good. Go have sex again and go do your life again. If you have pain with intercourse and, your brain is so powerful, so the last thing that your brain remembers from your vaginal tissue is pain from delivering the baby. So what happens is you go to have intercourse and you're like, oh, what's going to hurt? And what do? You tighten those muscles. So then your husband's like, are you okay? Should we stop? And you're like, yeah, it's going to hurt. And then there's this whole mess of things, and then you don't want to have sex again, which I don't want that to happen for either of you guys because I see it. So it's not normal to have pain with sex after you have a baby. It might be uncomfortable at first because you're not used to it. It might be different, but you shouldn't have pain that prevents you from having sex. And if it does, again, talk to your GYN, or you can come directly to one of us as women's health specialists. And this is what we do all day long and treat. So I don't want women to be embarrassed about it. It's so common, but I wish it was talked about more and women knew, because I see so many women, that are like, I've had sex for pain with intercourse for so long and I just deal with it. And then it can affect your marriage. So there are people like me that fix these problems. So that's not normal. You guys are almost, when's your due date?
5 weeks.
5 weeks. How about you?
March 25th.
Oh my gosh, exciting. So during pregnancy, I treat low back pain, tailbone pain, Because like I said, with different hormones being produced, your joints become lax. So your pelvis is preparing to expel a baby out of it. What happens is ligaments connect bone to bone. These ligaments lax so that your pelvis can expand, so that all your tissue can open up. So with that laxity, what happens is you can have pain. So pain in your back. That's why a lot of pregnant women complain of back pain or pelvic pain or bone pain. It's because of that laxity. You don't have those stable muscles. So I treat a lot of pregnant patients as well as then postnatal, that you're like, my back pain didn't go away after I had a baby, or my tailbone, it hurts when I sit on my tailbone. So we treat and work on all those effects in this area. So the other hand that I gave you, it's what's called a diastasis recti. Has anybody ever heard of that? Mm-hmm. Okay, so your belly expands and expands for you to hold the baby. So what happens is your muscles stretch. Okay, so what should happen is after you give birth, the collagen should bring those muscles back to this line. It goes from your sternum down to your pubic bone. It's called your linea alba, and those muscles should go back. Now, it's normal to have 1 to 2 fingers. Like even men, if you kind of put your finger between your abdominal muscles, you can kind of feel a ridge. It's like a dip, and then you feel the other muscle. That's normal. What's not normal is more than 2 fingers. So if you notice give your body time to heal, 6 weeks. But after 6 weeks, if you're noticing, and you can notice it now when you're pregnant, if you lift your head up and you see this like bulge of tissue, I call it like my pyramid bulge. It actually looks, or TP bulge. It actually looks like a ridge that comes out of that muscle lining. So a lot of my patients, and not to scare you, but it is common to have a diastasis recti. If there's a couple of precautions on how it can be genetic, again, how your collagen comes back, the strength of your muscles before getting pregnant. Petite women, they're more likely to get a diastasis recti. So again, it's more than 2 fingers that are separating the muscles. And again, if you lift your head, you would see this like bulge through your stomach. So if you see that and you have that, go see a women's health therapist, because it could just lead into more issues. What that bulge is actually your intestines bulging through the wall. So your abdominals are like a shield that help protect all your organs. So that tissue gets injured. And again, what makes me so frustrated is that at your 6 weeks, a lot of GYNs don't check for diastasis. And I see a lot of patients, they're like, I was Googling and I think I have this, but I'm not sure. And sometimes I see a woman come in, I'm like, nope, you're fine, that's totally normal. And other times I'm like, yeah, you definitely have it, we need to work on this. So we do a lot of techniques, manual techniques, taping techniques, and I show you correct exercises to do and not to do if you notice that you have a diastasis.